In cosmetic surgery or medicine, the patient goes through various stages and we call it the patient pathway. The first stage is the consultation, where we talk to the patient, we explain the patient everything that can happen. The second part is the preoperative consultation. Then the procedure itself, where we perform the procedure. And the last and the final stage is aftercare and how we communicate with our patient. I feel aftercare is as important as the procedure itself, because in any procedure, whatever we do, it involves the clinic or the person who is doing the procedure, the patient, how they're following the aftercare instructions, and of course, we can't forget nature, because sometimes infections happen, hematoma, seroma can happen, and other complications. We can take various measures to prevent them, but at the end of the day, occasionally side effects can happen and will happen, and the patient needs to understand that. The aftercare, if it is done properly, we can prevent some of these complications from happening and at least identify them at an earlier stage so that we can take control of the situation. At the Aesthetic Beauty Center, the patient gets a regular review, which is the 2 days, the 7 to 10 days, the 3 weeks, the 6 weeks reviews. The patient has 24-hour access to the doctor and the nurse. So at any time, day or night, the patient can have direct communication with one of us. It is really important, I think, that the patient has an open access so that the patient feels reassured that if anything happens, we are there for them. And we take aftercare very seriously at the Aesthetic Beauty Center, and we make that happen for the patient.